My name's Fiona and I'm the clinical team leader of Aspect Assessments, and as Trevor was indicating a minute ago, we did have to move very quickly to conducting assessments from in-face format until telehealth format. So to let you know a little bit about our clinic pre-COVID, we are a tertiary level referral service accepting referrals for autism specific assessments from paediatricians and other health practitioners, and we conduct a single clinician assessment model following the national guidelines and using standardised measures such as the ADOS and the ADIR. We typically conduct more than 400 assessments a year and primarily using face-to-face methods. That said, we had done a little bit of work where we'd kind of done a mix of telehealth and face-to-face, so a combination for families living rurally, where we would do some parts of the assessment via telehealth or telephone, and then some parts in face-to-face, and that was really just to maximise accessibility for some families. But of course, with the advent of the coronavirus earlier this year and the social distancing brought in as a result, that really severely impacted our ability to conduct these face-to-face assessments. So what we looked at doing was moving our standard assessment protocol across to a telehealth model. So on this slide, you can see what our standard assessment is. So it consists, broadly speaking, of 4 different parts. So prior to the assessment beginning, we seek to gather a whole lot of background information from parents, from teachers, any previous assessments or other reports that might be out there, and also to get some information about the person's self-help skills or their adaptive behaviour. For example, we use the ABIS-3, or the Vineland is another common tool that you could use there. That then leads into the clinical observation of the person being assessed, and we use the ADOS-2 to do that clinical observation, and then we pair that with a parent interview using that ADIR, and then if we need further information about that person, we do things with the phone interview with the teachers or the therapists as required. We also, then the final part of our assessment is around a feedback session. So we use that final part to give information about the outcome of the assessment, but also to make a whole lot of recommendations. And when we looked at moving that to a telehealth process, there was really only one area that needed to be changed. So the main part that we had to change to adapt this assessment process for telehealth was around the clinical observation. So our background information section remained much the same. We could use the same kind of tools and methods, although it was, we did give people the opportunity to provide videos if they had any home videos or other videos of their children, particularly interacting with other people. The clinical observation, however, needed to be quite different. So it's not possible to administer a standardised ADOS assessment over telehealth, I guess, due to the fact that it hasn't really been done a lot. So there is some research that indicates that telehealth for assessments is efficacious and effective, but it hasn't been standardised. So what we did is we took the ADOS to activities which our clinicians are all very familiar with, and we adapted them to be used via telehealth. So for a lot of the activities, particularly for older children, there was little change. We could share the stories or the images via screen sharing, but for children under 5, we really went to a model where we were coaching parents through a series of interactions so that we could observe the person or the child interacting with another person. The ADIR was unchanged except via telehealth, and same for the feedback session. And in order to try to maximise the effectiveness of this process, we kind of emphasised a few different things. So we felt that background information and collateral information from other health professionals or teachers or people working with the individual was even more important than usual to give us that context, and so we could get an indication of whether our clinical observations were typical. It was important to prepare people particularly around the technology, but also around what the parents would be asked to do, and then to be aware of the limitations, particularly around observation and that need for collateral, and to just prepare parents for how they might need to be involved. So that was our process. So Rue is now going to talk you through the evaluation that was conducted.
Thanks, Fiona. My slides up. Okay, so I'm Rue. I'm a postdoctoral researcher at ARCAP. So Vicky, Michelle and I, we designed this study to evaluate tele-assessments by gathering the perspectives of the participants, who are the adult clients, parents and carers, as well as the ASPECT clinicians. We looked at a range of areas for this evaluation. I'll share some of the main findings with you over the next couple of minutes. So just over a third of participants provided their feedback via surveys. A subgroup of these participants were also interviewed. All of the ASPECT clinicians who conducted tele-assessments were also interviewed. Feedback from the adult clients, parents and carers were generally positive. Over half of the adult clients were willing to be assessed via telehealth in the future. Similarly, a large proportion of parents and carers were also willing for their children to be assessed via telehealth in the future. In addition, almost all adult clients, with the exception of one person, and all parents and carers indicated in interviews that they would recommend tele-assessments to their friends and family members. For clinicians, assessments of school-aged children and adults were less challenging than assessments of younger children. From an observational perspective, eye contact and joint attention were the most difficult behaviours to assess via video conferencing. On average, confidence levels of the clinicians when conducting tele-assessments were high, although slightly lower than for face-to-face assessments. The majority of clinicians talked about relying less on their own observations and more on other sources of information from the clients' parents, teachers, and doctors. We concluded that tele-assessments is an acceptable alternative to face-to-face assessment during the pandemic. It's also a good option for clients who live far away from assessment centres, so who have to travel a long distance to get the assessments done. However, a number of considerations should be made when conducting tele-assessments, which include assessing the suitability of clients, developing processes to prepare clients well, and obtaining additional background materials from families, such as home videos, prior to assessments. Thank you for listening.